I also like to dress my oobs.
Your uniboob?
No! My old boobs. It doesn't have to just be for new boobs. Like, I have old boobs, oobs. Like, it never gets old.
No.
Like, you still want to, like, guidance from other people who have implants because clothes just sit different a lot of times. And so it's not just for your noobs.
It's for all your boobs.
It's for your oobs.
Welcome to BustmobTV. In the spirit of living our life with intention, me and Gretta Nance found some time in our day to pause, grab some coffee, and chat about what's going on inside Bustmob. We'll answer some questions, spend some time with a special guest, and share ways to be more intentional in your daily life. Hop on in.
Hello.
It's coffee and Bustmob intentional time. I didn't know what I was going to say there. I haven't thought about it.
Time.
It is.
We take 15 minutes, step out. Ish.
10,
gusts up to
15.
20, let's be honest.
Depends on if they notice that we're gone. From our day to talk about how our week is going and how we can pour into each other, you guys, learn from the community, talk about plastic surgery, talk about skincare.
What's going on in Bustmob?
All the things.
All the things. Speaking of Bustmob.
Yeah, what's popping off this week?
I've been noticing a lot of women posting like the dress photos, like, does this look okay to wear to a special event? Or one was a military ball.
Yeah.
One was a wedding.
Yeah.
One person had a dress and she had it in 3 different ways. Did you see that?
Yeah.
That was so cool.
Well, I just like, it's like we get these things and then we're like, I want to show them off, but especially the wedding ones make me laugh because it's like, I'm not trying to upstage the bride with my new boobs, but at the same time, I want to. So it's like such a sorority kind of feel of like, all right, we're gonna help you get prepared, and it's fun. Like, I keep finding new dresses and things like that. I'd want a wedding to go to.
So there was a photo that this lady posted with her cat. First of all, got my attention because cat. And then like her shirt came down really low and she had a lot of cleavage, but the shirt was so cute. And I asked her for the link and she sent it to me and I bought it today on Amazon and I'm so excited. It's like a crop top. You can't tell in the photo, but you can tell it's like plungy, but it's like almost like a knit crop top that's plungy and it looks so comfortable and I can't wait to wear it.
Again, Bustmob ladies coming through with the shopping recommendations. Someone actually, I didn't even tell you this, someone sent me all this Shein Halloween stuff they have with the boobs, like they have the pumpkins, they have the skeleton hands, and I bought 3 things.
You did?
Has not arrived yet, but I love any holiday that celebrates the boob. So I bought like a Halloween phone case, but Shein has they have like, I'm like, oh my God, I never thought about changing my phone case for the season, but I really like Halloween. So Shein Halloween, you should also check that out.
So when that crop top comes in, that I'm super pumped about, once I order it today, I'm going to take photos of it and put it on my Pinterest board because a lot of you ladies are like, well, how do I dress my new boobs after surgery?
Noobs.
We've all been there. And so I created a Pinterest board with a bunch of clothing, whether it's lingerie, bras, sports bras, tops, all the things. So you guys can get an idea of like different outfits for your boobs and you can actually click on it and it takes you there so you can buy it yourself. So the more you guys post in Bustmob, like the things that you like and things that you think other women would enjoy, like I'm going to buy them and take photos of it so all of you guys can check it out. And you can go to jennyeden.com and that's booby step number 5, how to dress your noobs. So
I love
check it out.
I just had a thought. I also like to dress my oobs.
Your uniboob?
No! My old boobs. It doesn't have to just be for new boobs. Like, I have old boobs, oobs. Like, it never gets old.
No.
Like, you still want to like guidance from other people who have implants because clothes just sit different a lot of times. And so it's not just for your noobs.
It's for all your boobs.
It's for your oobs.
Casey's like, y'all are stupid.
Okay, so we had some good Bustmob questions in the community this week, and I'm going to ask you the first one.
I'm ready.
And I think you're going to have to answer this one. No, I'm just kidding.
Okay.
Let's see if it actually plays. You know I'm good at this. Okay, let's try it again.
Okay.
There are so many different surgery centers to choose from. How do I know which is right for me?
Practices.
Yes.
I believe she meant. How do you know how to choose the right practice? Like,
Well, I'm
how do you know
gonna
when you
answer
go
that.
in?
You know what? It's all in your gut. We interviewed someone named Kelsi, who's a Bustmob babe, and she's actually Dr. Fredman's patient as well in St. Louis. So we interviewed her, and she had some really cool things to say about like how she knew when she felt like she found the right place.
Absolutely.
Thank you, Kelsi, so much for doing this with us.
Yes, absolutely.
And being a part of Bustmob, and you went to Amelia, St. Louis, is that right?
Yeah, I had Dr. Fredman.
Tell me about Dr. Fredman. What was your experience like there?
I thought that it would be more intimidating, maybe. I mean, I'm open and comfortable or whatever, but I think that it can be an awkward situation, and I don't really go to the doctor that often unless I absolutely have to anyways. And so it was weird how comfortable it was, but it wasn't weird, but it was comforting at how comfortable it was. I thought it would be more intimidating, and he's male and most of my doctors are female, so it was just kind of it was almost too good to be true. And I kept waiting for like the other shoe to drop at any time, either in the meeting or in the process, and it was just super easy. And I'm a very like anxious person, especially with kids. I'm always like super cautious, and I'm like, oh no, something's gonna happen to where this isn't gonna work out. And I never got nervous, even like with going into a surgery. It was really, really easy.
That
It
is
was
so
super easy.
cool.
That is awesome.
I love that.
Mhm.
Like, I want to like high five. Like, we've helped to create that system, and we like hope Bustmob and
Yeah,
other
well, and
tools
I
like that have set you up.
so I started researching and in the area. I didn't really want to travel if I didn't have to, especially with kids, and I wasn't really sure how much of a process it would be in the beginning or what exactly I needed to do. And so I had found Amelia prior to really getting into it, and then I don't even know exactly how I found Bustmob, but I found Amelia, and then I found the Amelia Academy, and it was just like click, 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 click. It was that simple. And so I was in Bustmob before I had my surgery, but I had contacted Amelia and talked to Brittany, and she had it to where I already had so I set up my consult, and when I kind of got into Bustmob and did the research about Dr. Fredman, because I wanted to make sure, obviously, I mean, everybody spoke his praise, but I still want to do my own research, which I think is smart. But I set up my consult, and I called her back like a week later, and I was like, I'm just gonna set my surgery date up. I said, I know my consult's like 2 months away, but I just want to set my surgery date up. I want to get everything paid for. I said, I know in my heart that's who I want to deal with. And she was like, well, absolutely, but if for some reason you come to your consult and there's not a match, she's like, then obviously there's no hard feelings. But it was never. I did my consult, and then 2 weeks later I had my pre-op, and then 2 weeks later I had my surgery. It's just kind of how it worked out. It was like visiting friends, even from day one. It was just very, very chill atmosphere.
That's so good to hear, because it is a nerve-wracking experience. It's still surgery. And so we work really hard to hopefully help all the ladies of Bustmob find a place that they feel that comfortable. So I'm so glad you had that experience.
Especially like if people aren't I'm an extrovert. So meeting people is, even though the situation is awkward, meeting people for me is not. But like, even if somebody went in there and like were quiet and shy, he's just mellow. He's very gentle. He's very kind, but he's informative at the same time. He's not like, I'm not going to say anything because you're not saying anything. Like he'll there's no like awkwardness at any point of it, which is kind of what you would not think about going into it. You would think, hey, you got to take your clothes off in the office, and you've never met him before, not prior to. And it was weird. It was super, super simple. I know that not everybody's experience is my experience, which stinks, because if you can have an experience like my experience, I think it makes not only your choice easier with some of that guilt that people will feel, but it makes it, I don't think it should be stressful. If you're doing something that's making your body feel better, it should make you feel good. It shouldn't be like, okay, now how am I going to pay for this? Because they're not releasing any kind of payment plan. And what size am I supposed to be? But they don't want to tell you your measurements, and they won't release what kind of implant. Like I feel like it doesn't have to be that difficult if you go to the right surgeon.
which I mean, do your research, but
That's
I definitely did my research, but I did only go to one doctor. I never did. I found him and I was like, I'm done. I don't want to go talk to anybody else.
When you know, you know.
Yep.
Yes. And you know.
But it's hard, like you're saying, to find somebody with that right vibe.
Yeah.
Oh yeah. Well,
Like-
and I don't think you can like Google that. That's why Bustmob comes in. Because like I don't think you could be like good surgeon
Cool
with good
surgeons.
vibes.
Good vibe
Cool
surgeon.
surgeons, yeah. I mean, reviews sometimes, but reviews are still more again on the more professional level where they're like,
Yeah.
oh yeah, their staff is nice and it was clean and whatever. But like Bustmob's like, no, this person literally just joked with me in their office afterwards.
Yep.
And so that is definitely why I think Bustmob plays a big part in it, because people are not only honest, but it's casual. It's very, hey, go to this person because, and then look at the work, look at my work.
Thank you.
Yes, thank you so much.
Okay.
Have a good day.
You
You
too.
too.
She loved Dr. Fredman.
She may be one of our coworkers
Yes.
one day because I think she wants to work there. But I do think there's like a gut head check that you have to listen to yourself. And I always say too, like this is a relationship. Like if you need something afterwards, you need to have that foundational relationship that you feel comfortable contacting that person afterwards.
Definitely.
It can't be transactional.
Yeah. And we hear that a lot in Bustmob too. Like, how do you know if this is the right surgeon, or I didn't like when this happened during my consultation and stuff like that? And women are always like, trust your gut, girl. If you can go on another consultation if something didn't feel right. So always listen, like check in with yourself. And if something felt a little off, there's nothing wrong with having another consultation.
No, I think it's also important to have a relationship with at least a couple other staff members too.
Yes.
You know, or because those might be the people you're communicating with as well. And you need to be like, all right, she's going to have my back.
100%. What's the next question?
Oh, I have no idea. We had a good skincare question from the Bustmob skincare group this week too, which is obviously my favorite hangout. So let me see if you can answer this one.
Oh.
I just turned 37. Is it too late for me to start using an eye cream? Will it still help my fine lines?
37's not
37 is
old.
not old.
I'm 30. I'll be 36 in a couple weeks. So I'm like, 37's just around the corner.
Well, I think a lot of people, 37 is a very common time to be starting to see it. And like, especially if you've had kids or all of that, you've been in like a bubble the last 10 years of just like survival. And now you're like, oh my God. Like, so no, it's very normal to not start investing in area specific products until that time.
That makes sense.
So the area around the eyes is honestly one of the hardest areas to treat. And it's one of the things people ask the most questions about in the Bustmob skincare group. So get in there and engage if you're curious about learning more, because this is just hard. There's a lot going on under here.
Yeah.
If you have allergies or if you're a sweller, you're puffy and you have issues with that, it's a very genetic area, as in you can look at your parents. If they have eye bags, they might have depressed
This is making
eyes.
me really sad.
I know. I shouldn't do that. It is not too late. Here is the eye cream I love that I recommend. This is not going to take away your fine lines and wrinkles. It's going to minimize them. It's going to start turning back some of that cellular turnover. Every now and then. I don't know the words. Lumiere Firm Riche is the one I use. There's Lumiere Firm. If you don't need the extra moisture, I do.
I don't.
And Jessie and I actually, Bustmob Jessie.
Is she in the back seat today?
She is not in the back seat today.
Fresh out of Jessie.
We went live in the Bustmob skincare group, which we're going to start doing every Tuesday at 3:00 Eastern Standard Time. And we talked a long time about all of the different under eye options,
Cool.
you know, all the way from CO2 laser and laser resurfacing
That sounds
to
intense.
blepharoplasty, the under eyelid surgery, to just an
need
eye
something.
cream. And why you shouldn't use your face cream on your eye, which can give you milia. You know, those little white clogged pores.
Is that what that is?
Mhm.
I've never had them, but
Yep.
I've seen them.
The skin is so different right here from just even right here. So
My
if you're
goodness.
using something super moisturizing here and you get it all up in here, you're going to clog up all of those pores. So that's why I'm a big fan of this eye specific product. And this is one of the only ones that's safe to use over the eye.
Oh, shit.
Like, that skin is extra thin and delicate as well.
So I've been
and,
poisoning myself all this time.
you know, Jenny, you are a work in progress, and we are getting there. I feel very comfortable with that. But this is a great product. It is not too late, girl. 37. I am 87 and
She looks great.
yeah, you have a lot of life yet to live, and Lumiere Firm Riche is a good
Where do you get Lumiere?
product. You can buy this on Real Simple Skin. Real Simple Skin.
It's 3 words.
Not Rumpelstiltskin, like sometimes I say. RealSimpleSkin.com. The entire site is 20% off right now.
Ooh, and free shipping.
And free shipping always.
I get a little loud when that happens.
So personally, what are you doing or focused on or working on or reading this week to improve you? What can you teach us?
Well, I started reading this book called Burn After Writing. And it's not so much of a reading book. Like you have to have read the beginning because I never do that. And I feel like it was important to read the intro. So I did. But it's kind of like a journal in a way.
Okay.
So it has you focus on like your past, your present, and your future. And part of the beginning of the book, it talks about you don't start from beginning to the end. You have to just open the book and trust that that's where you're supposed to go.
Oh my God.
And then answer it right then. So it's a whole book about like self-discovery of who you are in the past, present, and future. But you can't go from the past to the future.
I haven't heard you talk about that. Well, you talked about it in Brunch Club
I
with
did.
Kelsi.
With Kelsi, I did.
Where did you get this? I think I might need this.
I got it on Amazon.
Oh my God.
And
okay.
they have like a bunch
This
of different
sounds
covers.
fun. I like
It is fun, but it's also kind of like, it says like trust the process. Like you have to trust your gut that where you open it is where you're supposed to be. So it's like, okay, because it's funny. I always thought that would be simple, but we're so trained when we open a book to go from left to right, you know?
Yes.
And so just to like open it and hope for the best.
Yeah.
I mean, it's a little intimidating, but it's really cool because one, it gets you out of your comfort zone. Like you don't know what you're about to hit. And then you have like just on one page, I spent 2 hours on Sunday, like thinking about the answers because the whole premise of the book is no one's going to read this but you. So you have to be as honest as possible. And then once you're done with the book, you burn it.
That's really cool.
It's so cool.
I really
it's
like
intense,
that.
but it's fun.
Okay. I
And
might have
it's
to
so
try
fun.
that.
I mean, it's kind of fun, but it's also like, it forces you to think really hard about your answer, knowing no one's going to read it, you know? So there's like no judgment. You can't judge yourself, and it's going in this book, and it's just, I don't know, it's been really powerful.
That sounds like the ultimate exercise in intention, which is just like something I think we're all, like every time I post something about intention, everybody's like, that was my word of the year this year, or that was this, like everything is so sped up. To me, intention is unwinding that and just being present right now and intentional or just aware. So that sounds like a really cool exercise and not just rushing to the end. It made me think, I didn't know where you were going at first with that one of the very first workbooks I worked through at a personal retreat was that kind of storyline. And it was like kind of write this story. You're almost documenting the story of your life, but you're not supposed to start at the beginning. And it's just, it does force your brain to think differently. So I might really need to try that.
I like it a lot. And again, it's on Amazon. You can get a hardback or you can get, what do you call it, softback?
I do not remember saying that, but it actually does sound like something I would
It
say.
made me laugh, but it's, what do you call it now? I can't think.
A paperback. Paperback book.
But you can like customize like what cover you want. So I got ones with little flowers, but you can get it, like, it looks different. But I got the cheapest one. And it's just, I don't know, I love it so far. And it's on my nightstand. So at night, if it's there and I just want to open it and do one page, I can. But it's, I don't know, it's fun because I don't know where I'm going to land.
Yeah.
You know, and it just, you
That
can either go
sounds
back in the future or
really
go
cool.
back in the future.
Back to the Future.
Oh,
I
it's a
love
movie.
that movie.
You can go back into the past or fly into the future. You just don't know where you're going to land.
Maybe we should buy a couple of those and do a giveaway of that too. Because that sounds like a really fun, like that even sounds like a good gift.
Yeah.
Like that sounds like a good personal retreat type exercise. Like I'm really digging that. Are you doing a personal retreat this year? We've talked about those before. Jenny is actually the one that introduced me into this whole concept. And I have been a big fan.
Yeah, I should take one. I might go to Jamaica, and if I don't, I'll take a personal retreat. Or I'll make my Jamaica trip a personal retreat.
I like that you can make it whatever you want it to be. But again, it goes back to that intention of you are pulling away. You are maybe getting out of your comfort zone. I've done some at my house and some at like an Airbnb. People do them at hotels. People go camping. But it's just like I'm going to take 24 to 48 hours to put my phone down.
You're looking for your phone?
I know I was. And intentionally work through a workbook or journal. Kind of, I like to look back. I usually do mine around January 1st and I look back and then I make, given what I wanted or didn't want out of the past year, I make choices and plans for the future. So you don't always have to do it that way. It's whatever you want to do. So that sounds like a really cool journal to kickstart some kind of concepts like that. If you want to join us in having these kind of conversations, that's what Brunch Club is for. That's kind of like why we did it. Like Bustmob is a great place to have conversations about surgery and supporting each other. But the Instagram Brunch Club on the Bustmob Instagram is a great place to keep growing.
And if anyone wants to be a part of Brunch Club, let us know, because we would love to interview you about your surgery, or if you're passionate about a topic around like your personal wheel of life, whatever that looks like, we would love to have you on.
Yeah, teach us some stuff.
Yeah.
You inspire us every day.
Heck yeah. But you know what? We've been out here for longer than 15 minutes. So
And I have sucked down this venti, so it's time to use the restroom.
Yep.
Get back in Bustmob.
My quad's kicking in, my
my
quad
God.
shot. Gotta go. Bye.
Thanks so much for watching. To join Bustmob, shop for swag, or follow me and Greta on social, click the links below. See you next time.